Merci, Dr. Leduc. Bonjour à tout le monde. Thank you very much for coming here. I want to talk to you about heart attack. Heart attack, the top killer. What do we know about heart attacks? The facts are that heart attacks happen most of the time in people who never had any prior symptoms. They had no warning, no history of angina, and suddenly they have a heart attack. Most people think that heart attacks happen in people who have had problems, and it's not true. Over 80% of heart attacks happen in people who have had no prior symptoms. Everyone is at risk. We all have some cholesterol plaques in our arteries, and these plaques can get us into trouble. We cannot predict heart attacks because the mechanism of heart attacks is unpredictable, and I will explain to you why. Maybe we can do something to prevent them. We can at least try. So what is the cause of a heart attack? We have plaques in our arteries in the heart that cause narrowing in the arteries. But that narrowing does not have to be severe for the heart attack to happen. You can have a mild narrowing in the artery, and then suddenly that plaque ruptures, and now there is a blood clot that forms and closes the artery 100%. So you can start with a 20% blockage in your artery, and within minutes, it goes to 100%. And that's why 20% will not give you any symptoms. Even when you exercise, you can run the marathon. And then when that plaque ruptures and causes a blood clot, and the artery now is 100%, you're having a heart attack. What we're trying to prevent, the death of the muscle of the heart. This black area here, this is a heart attack. This is what kills people. If you have many of these scar tissue, multiple heart attacks, it weakens the heart muscle, the pump doesn't function properly, and people die of something we call congestive heart failure. But worse than that, these scar tissues caused by heart attacks, if you survive the heart attack, you can have an arrhythmia, because that area here is a substrate for an arrhythmia. The heart is irritable, and people die suddenly. So if you look at the heart pumps blood to the rest of the body, but also pumps blood to itself through these arteries in red. We call them the coronary arteries. And these arteries, when they are filled with cholesterol plaques, this yellow thing here, and it starts at a young age, the cholesterol plaques do not narrow the artery enough to cause symptoms or to show on a stress test. And these plaques are dangerous because when they rupture, they close the artery. I'm going to tell you about a patient that came to me years ago, and he was very upset, and he wanted an explanation. AJ, and I call AJ the brother, because AJ, he came to my office for a second opinion. He was upset. His younger brother died a year prior to his workup. His brother had a massive heart attack and died. And AJ went to see his family doctor to say, what is my risk? Is the same thing going to happen to me? So the family doctor appropriately referred him to a cardiologist, and the cardiologist appropriately ordered a stress test. And AJ was not feeling any symptoms, completely asymptomatic, but he smoked, his cholesterol was high. So what did the stress test show? The stress test came back normal. He had a normal stress test, he passed it. And he was told he had no significant blockages, he was discharged from the clinic, and he was given an advice to quit smoking and change his diet. But AJ didn't. 5 months later, he was sitting watching TV and suddenly felt a chest tightness going to his throat. He had difficulty breathing, and he was getting worse. He became sweaty. He called 911. They did an ECG. They diagnosed him with a heart attack, and he was taken urgently to the cath lab at the Heart Institute, and he had an angiogram and a stent. So he was upset that the stress test did not pick up the blockage months before. And he wanted an explanation. This is not his angiogram, but this is what his angiogram looked like. And you can see here, this blockage right here, and it's filled with clot, and this is after a stent placement. This spot here in the heart, we call it the widowmaker, because it kills a lot of people. So I explained to AJ that the artery, when it's filled with plaques, it narrows and it prevents the blood flow to flow normally in the arteries. Usually you need more than 70% blockage in order to have any kind of symptoms. Angina when you're running, chest pain or shortness of breath. But he didn't have more than 70%. He probably had 40 or 50% blockage. What we do with the stress test, we're able to pick up a blockage that is more than 70%. So somebody comes to my office and he says, every time I run, I get chest pressure. I do a stress test, it is abnormal. I do an angiogram and I find an artery that is blocked more than 70%, and then we put a stent, and this is what the stent looks like. And this is how we deploy the stent. There is a balloon sitting on the stent, you inflate the balloon, and the stent sitting on the balloon, you inflate the balloon, and then you remove the balloon, the stent stays in place, and it stays in place forever, and it opens the blockage. This is useful in people who are having heart attacks or people who have stable angina, and we find an 80% blockage, and now they can go back and play golf without having symptoms. But unfortunately, over 80% of heart attacks do not happen in blockages that there are 80%. You can have an 80% blockage and have angina, and it will remain 80%. But the 40% blockage that is scary, because that 40%, and I'm going to go through this picture because it's a little bit complicated. This is a picture of the coronary artery, and then we're slicing it here like you slice bread, and we're looking in the short axis. And because the light here is too bright, but you can see here there is these yellow, and then this is the lumen, the opening of the artery. What happens, this is a 20-year-old, and as we get older, these plaques started building up in the wall of the artery. You can have a lot of cholesterol in the wall of the artery without obstructing the lumen of the artery. So you can have a 10% blockage. When you put a dye here, you will see there is only mild narrowing, but a lot of the plaques is actually sitting in the artery. Eventually, that plaques will narrow the artery further and further, and then when you get to more than 70% narrowing, you start getting symptoms. But what happens is at any stage in this process, even when it's 20%, you can have a rupture of this plaque. It's like an eggshell protecting that plaque, and it ruptures. And then it mixes with the blood, and it forms a blood clot and causes a heart attack suddenly. So you go from 40% to 100%. And this is what's scary about heart disease. This is a real picture of a patient that we took the blood clot out. So we sucked it out when he was having the heart attack. And this is what you see. This is what's causing the heart attack. So this is the cholesterol plaque that ruptured, mixed with blood. The blood coagulates, forms a clot, and this blocks the artery 100%. Stress tests are useful in finding more than 70% blockages. But if you have a 50%, it will not show. You will have a normal stress test. But that doesn't mean that you can continue to smoke or lead a bad lifestyle. So what happens if you do an angiogram and I tell the patient you have a 40% blockage? What happens to that 40%? Well, three things can happen. It can remain the same forever till you're 100. It can progress slowly and it becomes 50, 60, 70, and then over 70 you start getting symptoms with exertion. Or it can rupture suddenly, and within minutes it can go to 100 or 99% and causes a heart attack. We all have these plaques in our arteries. We all do. Some have more than others. So how do we know which plaque, what's going to happen to that plaque? Well, not all plaques are the same. Some plaques are stable, they will remain like this forever, and some will rupture. are called unstable plaques. This is a picture of a vulnerable plaque. You can see this is the cut of the coronary artery, and the cholesterol plaque is sitting, and the artery is blocked maybe 60%. It's not causing any symptoms. And then when it ruptures, the blood closes the artery completely. This is actually a picture of a CT angiogram showing a narrowing less than 70%, let's say 50%. That should not cause chest pain. So if we cannot predict, we don't have the ability now to know which plaque is stable and which plaque is unstable. So basically, we cannot predict which plaque is going to rupture. So if we cannot predict that, then can we prevent it? Well, they tried stents, to put stents in a 50% blockage. They made it worse. You actually can destabilize the plaque and you make it prone to rupture. So what do? Well, medications really are the key treatment. In Framingham, they followed 3 generations of families to look at answers, why people get heart attacks. And they gave us a list of what we call the traditional risk factors. The more risk factors you have, the higher your risk of having a heart attack. And these are age, family history, whatever happens to your brother, your father, your sister, your mother might happen to you. Cholesterol, especially bad cholesterol, diabetes, and hypertension. The more of these risk factors you have, the higher the risk. So the other issue is that we do stress tests on patients sometimes, and it shows that it is positive. They might have a blockage. They might have an artery blocked more than 70%. And a lot of time it can be false. We call that a false positive result. Before the CT scan, the only way to know if the stress test is truly positive, that the patient has a blockage or not, was to do an angiogram. And that's what I do for a living. I put catheters in people's groin or wrist, and we go up with the catheter. We inject a dye into these arteries, and we take a picture, and we identify the blockage. It is low risk, but still it has risks, this procedure. So you go from a stress test that is false positive, you have no blockage, we do the angiogram, put you at risk to prove that it is not true. And this is what we would see as a blockage on an angiogram. The CT scan will change that. The CT scan will be able to prove or disprove the stress test non-invasively, without having to insert catheters. This is the exact picture of a CT scan we're getting at the Montfort. It's the state of the art. It's one of the best on the market. It is clear. This is a picture of an invasive angiogram, and this is a picture of a CT angiogram. And you can see the artery very clearly. It is quick, takes a few minutes, a breath hold. You inject a dye, and then you process the images. It is accurate. We can see the whole heart with one picture. So what is the role of the CTA is going to be? You can't do CTA on everybody walking on the street just to look for plaques. Because everybody, I assume that all my patients have plaques. I have plaques. Everybody has plaques. So what is the role will be? It can identify the plaques early, that is true. And what we want to pick up is the people who have probably more plaques than others, people with family history, with risk factors. The patient who says, my brother died with a heart attack, what's going to happen to me? And he's refusing to take a cholesterol pill, for example. I might convince him to take the pill because he has a lot of plaques. I can risk stratify patients better. It can identify severe blockages non-invasively. It can prove or disprove a stress test result. But remember something, the CT will not be therapeutic. It will not fix the blockage. If you need an angiogram, you need an angiogram, and you cannot put a stent through the CT. So people who need the invasive angiogram, they will still need it. It will not replace it. So in conclusion, stress tests detect only blockages more than 70%. Most heart attacks happen from blockages less than 70%. Patients have absolutely no symptoms, no warning. Stress tests cannot predict plaque rupture, cannot predict heart attacks, but if you have a normal stress test, it's still a good thing. It's better than to have an abnormal stress test. Because if you have more than 70% blockage, the chance that you have other 40, 50, 30, 20 is very high. And it's a matter of statistics. The more plaques you have, the higher the chance of one of these plaques rupturing and causing a heart attack. CT angiogram and invasive angiogram can identify blockages less than 70%, but we treat them with medications. Plaque rupture is the cause of most heart attacks, and mechanism of plaque rupture is very complex. Unstable plaques tend to rupture, but right now we don't have any test that can say this plaque is stable or this plaque is unstable. Maybe in 20 years. So far, we don't have that ability, and prevention is always better than treatment. CTA, CT angiography, will be able to diagnose patients with chest pains quickly, accurately, and it will be able to help us do the preventative treatments. Thank you very much.